Dr. T, thank you so much.
Thank you for interviewing me.
Been looking forward to connecting with you, especially because of this new exciting movement around the Clary sage seed oil that I've been hearing so much about it, and I feel moved to join the happy family. This is really an amazing turning time in our lives, and I have a sense that something special is happening here around the omega-3 oil, and I have a few questions to clarify for me and give me more confidence about taking this new step into this opportunity. Would you be willing to clarify these questions for me this afternoon?
I'll do my best.
Great. That's all I need, is more clarity. And you're such an authority in health and brain chemistry and just in general, an amazing medical expert that...
We always have to learn.
You're learning.
We never stop learning.
That's what I admire about you, and thank you so much for continuing to learn. Even before this interview, you're constantly learning, and I'm just going to pick your brain a little bit. Okay?
Okay.
All right. So speaking of the brain, that's the first thing I want to talk to you about is I work with a lot of people and had the privilege myself to overcome serious issues like bulimia and bipolar and the brain chemistry. I've come a long way, and I notice folks working with food directly are able to get off medications and heal severe conditions. And I have a sense that Clary sage seed oil, the omega-3 component, has something tremendous to offer for those of us who have mood disorders. What's your take on this?
Well, omega-3 oil, and in this particular case the alpha-linolenic acid, or ALA, has been shown itself to be extremely effective in anti-inflammatory condition, in fighting inflammation and acting as an anti-inflammatory, especially in the issues of mood, mind, and focus, mental health in general, learning disorders and learning difficulties. People who have been using a higher dose of ALA in their diet seem to be directly improving their health in all of those mental issues. Plus, people with neurodegenerative diseases or diseases of the brain seem to be improving substantially when they increase their ALA in their diet from any source. But it's especially nice and especially exciting when that source happens to be stable ALA, since ALA is generally an unstable molecule. And it's extremely beautiful that we finally have that molecule in a stable form.
So what I'm hearing you say is the ALA molecule is really this component that would uplift many people's struggle with their moods and lethargic, hard to get up in the morning, and people want to make a difference in the world, yet it's so hard to get over all these obstacles. And you're saying that this stable component, and what makes it so stable in this particular oil? Because I hear there are many other sources of omega-3, and stability seems to be like a big key to actually have a change.
We still have to study and find exactly why this oil is so miraculously stable. We know that there are many other components within the oil, very powerful antioxidants, anti-inflammatory substances, phytosterols, sclerol, and others, various types of vitamin E, all types in fact, that probably add stability, and maybe there are other components we don't know about yet. But the studies have confirmed positively that this is many hundreds of % more stable than other sources of omega-3 oil, without knowing exactly all the reasons for it. We just know it's stable. We know it can hold in room temperature for over 2 years without becoming rancid, and that is an amazing trait that we normally don't see in omega-3 oils. In fact, some industries feel obligated to change the omega-3 oil and increase more omega-6 within it just to improve its stability. And this one does not need that. In our society, which has so many people eating excess of omega-6 fatty acid, such that the ratio in most people in Western civilization is more than 15 to 1, omega-6 to omega-3. We need something that would give us a really good ratio of omega-3 to omega-6. And all the other sources of omega-3 oils don't give us a really good ratio. Even if it's 2:1 or 3:1, it's not good enough because they still give us enough omega-6, which we have too much of. Here we have something with a ratio of 150:1.
150, that's unheard of.
Yes, it's the first time that we have discovered anything like that.
150. Now, does this contribute, this ratio? I want the viewers and myself to understand even more the importance between omega-6 and omega-3. How does this contribute to the whole cholesterol issue and the high blood pressure? Does that play a role in that challenge for people?
Studies have shown that omega-6 fatty acids contribute to inflammation because they lead to the formation of arachidonic acid, whereas omega-3 fatty acids are cardioprotective because of their anti-inflammatory effect. And indeed they have LDL cholesterol lowering effect. You know, the so-called bad cholesterol is reduced substantially and significantly with a high quality ALA. And the more stable it is, the more effective it will be in lowering the LDL cholesterol and in improving overall cardiovascular health.
This is amazing. So what I'm hearing you share with me right now, Clary sage seed oil, the top two qualities that we just covered right now, you know, the brain chemistry right there, coming out of the fog and feeling better and easier to get up in the morning and support your family and live your dream life. Really, many of us want to live a dream life, but it's hard to get out of the fog. So there's an natural antidepressant here, and the second issue of, you know, our heart and cardiovascular health, which is so crucial.
Right. I like to emphasize that this is not just designed to combat specific symptoms or specific diseases. The more important thing is to realize that the underlying mechanism for most disorders and diseases of the 21st century is inflammation. Inflammation affects our nervous system as we age. It's associated with multiple sclerosis, with autoimmune diseases, with brain disorders in general, with cardiovascular disease, with cancer, with osteoporosis. Almost any condition that is chronic is associated with inflammation. So when we want to lower the tendency towards inflammation, we need a high quality stable omega-3 source as a preemptive effect, as a measure that will bring us towards health instead of allowing the omega-6 that we are inevitably exposed to in excess because we have so many grains, so many legumes, and so many oils in our diet containing omega-6 fatty acids. We almost have no choice but to consider an omega-3 source that would offset that and improve our chances in preventing and reducing the likelihood of developing all of those cardiovascular diseases and cancer and autoimmune disease and inflammatory disorders and osteoporosis and skin disorders, anything that is associated with inflammation. If you happen to have those symptoms, like you mentioned, the depression or the mood disorders, then it will be one important component towards helping you get better, looking at all the other potential causes simultaneously. No matter what, you have to address the inflammatory component.
This is loud and clear. I'm really getting it right now. The inflammation is at the root cause of everything that we're struggling with today in the 21st century, and makes me think of the next generation. Really, I'm thinking about becoming a mother, and I know that the omega-3 oil, especially the Clary sage seed oil, has something special for not only the mother, but also the baby. What is your take on the mothers and babies?
Well, you know, in nature you would be eating a lot of green leafy vegetables, and they do contain some omega-3 in the form of ALA. And in fact, many authorities and some countries and governments have decided to give a minimum dose of ALA as required in the nutrition of the unborn baby and the newborn as well. They don't mention other forms of omega-3 fatty acids, even though the population likes to eat other types. But they do mention ALA as a required fat, a required oil in the diet of the mother-to-be and the newly formed mother as well. The ALA is continuously discharged through the breast milk, and it is going easily through the umbilical cord, more than any other types of omega-3 fatty acid. It is the main source of omega-3 fatty acids in the newborn and in the embryo as well.
ALA. So this is the key here.
ALA, alpha linolenic acid. Just say it, alpha linolenic acid.
All right, here I go. Alpha linolenic acid.
Excellent.
And if you're watching right now, you can try that mouthful as well, and it does get easier over time. Just saying it already uplifts my mood.
Yes.
Thank you. This is really fantastic. I'm getting more clarity and confidence, which is exactly why I wanted to have this conversation with you, for my own health, for the health of my next generation. What about the generation that was prior to me, which is really important to me as well, my parents, my uncles, my aunts, because I want to get involved with this movement and I want to make a difference in the lives of all those that I love. What about our elders? You know, Alzheimer's and conditions that seem to be connected with aging, but maybe there's something to it more?
Right. Aging to me is simply the cumulative effect of lifestyle. People who have a healthy lifestyle don't experience the biological aging, even if they age chronologically. Cumulative toxins, cumulative omega-6 fatty acids, cumulative inflammation, and cumulative autoimmune disease, which feeds on inflammation, are all at the root of these so-called aging diseases. And people who have aged ungracefully are the ones who have accumulated greater amount of inflammatory sequela, or greater amount of inflammatory damage over the years, because they did not have a balanced diet between omega-6 and omega-3, among other causes. Therefore, if they address that and improve their nutritional balance by increasing the ALA content in their diet, their own body will be able to use that ALA directly for its cardioprotective effect, directly for its anti-osteoporotic effect, directly for improvement of their mind, mental issues, and other degenerative disorders, and be one component in the help towards a better lifestyle or better longevity and vitality that they deserve to have. It's not the miracle cure for everything. It is basically an important basic component of health that should never be ignored. But unfortunately today it is ignored all too often, and that is why we see departments of geriatric medicine with people who seemingly have no hope, and they are on drugs which don't help them. Many of the drugs actually prevent them from utilizing ALA in its best form and converting it into the types of omega-3 fatty acids that ultimately incorporate into the brain. ALA is a precursor to DHA, and it is converting in the body to DHA. And DHA is very important in brain structure and brain function. We don't need a lot of it, but we need some of it, and our body can convert